Assalamu alaikum, hello and welcome to the Health Show Live here only on the Islam channel, and our last episode for this, our first series with me, Alistair Greener. Now, during this series, we've aimed to cover serious health issues that we hope have helped answer a range of questions on topics that have included cardiology, addictions, dementia, women's health, as well as mental health and HIV and AIDS. Today, we're going to be looking at the importance of cancer screening, breast and cervical cancer in particular, as the rates of screening for these are much lower in the BAME communities. And to discuss this topic, we're welcoming Dr Hina Shahid, who is a GP with graduation in distinction in medical sciences at the University College of London. Now, we must stress that should you suffer from any medical problems, it's always highly recommended that you contact your doctor or GP, as the Health Show is giving you an alternative viewpoint to the health concern being discussed. Now, if you'd like to speak to our expert today, the number to call will be 020 7374 6423, but please don't call just yet, as the lines will be open later on in the show. And you can also email us if you prefer at healthshow@islamchannel.tv. So it's lovely to see you, Dr Shahid, and thank you very much for coming in.
Pleasure, it's lovely being here.
Now, we're going to talk a little bit more in a while and answer a lot of questions, but before we do that, let's have a look at the world's oldest yoga teacher, who at 96 years of age still teaches 5 classes a week. But above all, Tao Porchon Lynch is a poster child for health and positivity in a world obsessed by wellness and longevity.
Nobody's beat me for 5 years. I'm still the oldest one in the world, still doing yoga. So I never look for what can go wrong. Oh, why should I think? I never even thought about how old I was. I can still do things. Only washing it. I drink fruit juice. Actually, I eat half a grapefruit every day and some juice. And if I remember to eat, because I'm never very interested in eating.
Two things are incredible to me. Number one is the fact that she can do things that I still can't do. and then the second is just like she said something in there about where there's a will, there's a way. And so I think I was encouraged by that too.
That was what Gandhi said. Men have wonderful visions, but it's the women that put them into practice. And so he was always telling that live together, share everything.
Oh, it inspires me, because if she can be 98 and still driving and still living on her own and doing asanas like this, it gives me hope.
When I get up every morning, I believe, and I believe sincerely this, whatever you put in your mind materializes. And never procrastinate and say, I'll do it tomorrow. Tomorrow never comes. 1 minute after midnight is already today.
Wow, how amazing. We were just watching there with you that video, and Dr Shahid, it's just amazing to watch somebody 98 years old look so good, and to link that with our topic today of screening. Obviously that wouldn't happen if she maybe hadn't been screened, because you never know what's around the corner.
Yeah, I mean, it's so inspiring to see somebody at that age looking after their health, so proactively. And that's sort of what we're trying to do with screening as well, is to try and keep people well, essentially.
Okay, so let's get through the different topics. First of all, we're going to be talking predominantly about cervical cancer and that screening, because that's the one that, we feel is possibly the most important and the one that's, you can really find things early. Because tell me a little bit about the screening, what it aims to do.
So cervical cancer was introduced in the 1980s, and we have found that actually it saved about 4,500 lives from cancer. What we're doing in cervical cancer is not really looking for cancer itself. We're trying to find early changes and signs of abnormalities or infection, which, if left unchanged, could develop into cancer. So we're trying to pick up changes very, very early, and that's why it's such an effective program.
And again, as opposed to breast cancer, where there's a physical change, there might be a lump, there might be something. Often, I presume, women won't know of any of these changes because it's internal.
Yes, absolutely. So with cervical cancer, if you do get symptoms, it's very, you might have cancer, but also there's a chance that it's quite advanced, in which case your options for treatment and cure are reduced. With breast cancer screening, again, we're looking for very early stages of cancer, which are too small for women to perhaps feel or see. So again, it's fine. Screening is about looking at healthy people and identifying problems early on, so that we can increase treatment options and chance of survival.
So with cervical screening, at what age does that start? What age does it go to? Is there like an age range which is particularly focused on?
Cervical cancer in the UK starts at the age of 25, and women are screened every 3 years until the age of 50, and then between the age of 50 and 65, women are screened every 5 years. And the reason for that is because it's a cancer that predominantly affects younger women. So most of the cancers that we see with cervical cancer affect women in their 30s and 40s. We are seeing slightly with older women as well now, but that is the bulk of the population which is affected.
And is it one of those cancers which is hereditary? So, for example, if you're a 22-year-old woman who's maybe there's a bit of a history of cervical cancer in the family, can you then get screening? Are you more likely to get it, and are you then able to get screening younger?
Cervical cancer isn't influenced so much by genetics as infection. So 99% of cases of cervical cancer are actually caused by an infection by a virus called HPV, human papilloma virus. And so we screen for that as well when we're doing the cervical screening.
And that particular virus you mentioned, how does that manifest itself? How do people catch it?
The virus itself is very common, and it's spread mainly through sexual contact. There are lots of different strains of HPV, but there are a few strains that are particularly associated with cancer, with cervical cancer, and those are the ones that we're trying to find. And
so if somebody has this, whether it's a man or woman, they're not necessarily going to know that they've got it. It's just something that's there, is it?
Exactly. It doesn't cause symptoms, so that's why we need to screen for it to identify it and then offer treatment.
So let's say someone has gone for the screening, because I think, do women automatically get called up in Britain? Would you get a letter from your GP saying it's time?
Yes, you'll get a letter from the National Cervical Cancer Screening Centre, and women will be invited to go to their GP and have the smear test done. And
this is done locally by your GP?
Yes.
And then how long do you normally then have to wait for any results to come through?
So from the point that you have your test done, you will normally be given a letter to tell you the outcome of the results within 2 weeks. And your GP will also get a copy of that letter.
So for any reason someone has slipped through the cracks and isn't getting this letter, they need to make sure they've told their GP, I'm supposing.
Yes, absolutely. If you haven't heard within 2 weeks, then it's really important that you follow it up. It's very unlikely to happen, but we always tell women to follow it up if they haven't heard anything by calling their GP.
Now, once, let's say, for example, the test has shown something isn't quite right. Of course, the important thing that you were saying earlier on, it doesn't mean it's necessarily cancer.
So with cervical cancer, we're not looking for cancer. We're looking for those early changes in a very, very small proportion of women, so about 1 in 2,500, which is very small. It will identify cancer, but like I said, that's the exception rather than the norm. What we're looking for is early changes, so if they are there, then those women will be offered extra tests and treatment.
Okay, so talk a little bit more about those extra tests and the treatment that you would go through, because often people, it's that sort of almost ostrich syndrome, isn't it? That I don't want to go there because I don't want to get the bad news, but again, this is very much pre-cancer. So
Yes.
what would actually happen in the next stage of testing and treatment?
So when you have the test, you're tested for two things. You're tested for whether you've got abnormal cells, and then secondly, whether you've got the infection HPV that's been introduced since last year. So it's still being rolled out across the country. But now that's what we're doing, we're looking for those two things. If you're then classified as moderate risk or high risk of cervical cancer, you then are referred to a special clinic called a colposcopy clinic, where you have a camera test by a specialist, and they will have a closer look at the cervix, which is the neck of the womb, and look for any abnormal changes, and then you'll be given often treatment there and then.
And that literally can stave off development into something more serious.
Exactly, so it can prevent you from developing cervical cancer.
Now, obviously, it seems to me such an obvious thing. Absolutely, someone's there, it's a free test in Britain, have it. But there is a reluctance by some people, especially in the BAME community, who might not be terribly keen. Talk to me a little bit about that. What are the things that are making people reluctant to go?
There are a few things, and we do know that in the BME community, the screening rates are lower than the national population. And there has been some research done to look at this, and some of the things that have come up are the perception of the test is uncomfortable or painful, or it's quite a private matter, and so it's really important just to educate women and dispel some of those myths. So, it's a very straightforward and simple test. The actual smear test, it's really safe, doesn't really cause any problems or complications. So, it's really important they do go and have that. Some of the harms that can come from these tests are more to do with the colposcopy side of things, where you might have a bit of treatment, and like any other treatment, you can have some complications. But the smear test on the whole, it's very safe.
And I presume one of the things that people might be a little bit concerned at is, well, who's going to see me? Am I guaranteed that can I ask, for example, that it's a woman who conducts the test and so on, and that my privacy is maintained?
Absolutely. So with any kind of female procedures, we always try and make sure that it's a female clinician. So whether that's a nurse or a GP, often the cervical smear test is done with the nurse who is female, and we always try and make sure that it's done in a safe space where the woman's dignity is preserved.
Because again, it is a very private thing, and again in this community, it's something that's often not discussed, is it?
Absolutely. So, it's not something that we would kind of ask our friends or family about. Have you had your smear test? It's kind of quite hush hush. So there needs to be that conversation around it, and the fact that it is important. It saves lives. It prevents you from getting cancer. And identifying those women who, particularly the younger women we see, are quite reluctant to have the smear test for all sorts of reasons. They might be busy as well at work, or and then the older women, they may not really understand what it's about. So explaining to people what it's about and what the benefits are is really important.
And I presume there are things that one can do to actually just reduce your chance of getting those infections in the first place. Obviously, you can't necessarily prevent contracting this virus, but are there any things that we can do in our daily lives that will, if you like, stack the odds on our side?
Yeah, sure. So the other risk factor is quite strongly associated with the smoking. So we would always advise women to stop smoking, not just for preventing cervical cancer, but obviously all the other cancers and health problems that are associated with smoking. And then in general, having a healthy lifestyle, eating healthy, doing exercise, yoga, as we saw earlier today. So just being more proactive with our health and well-being, especially in today's stressful society, it's more important that we do take measures to look after our health.
Now, this has been a hugely successful programme, hasn't it? I think you mentioned over 4,000 lives are saved every year, so it really is absolutely critical. What sort of advances are we making in terms of the future to maybe save even more lives?
Like I mentioned, we now have the introduction of testing for the HPV infection, which we know is strongly associated with cervical cancer, and it's hoped that will save even more lives. Now, when it's then rolled out across the country. At the moment, it's still in a few areas, but hopefully that will save even more lives because it's catching those changes even early. So it's catching the infection before the abnormal changes develop, before the cancer develops. So it's further down the chain.
And again, obviously, as we've said time and time again, for goodness sake, get yourself tested. Just in the last few minutes before we go to break, let's talk a little bit about the screening for breast cancer, because women will be very familiar with the message of checking yourself, making sure that there isn't anything abnormal about your breast. But what about this screening? What's that process?
Screening for breast cancer is a little bit different to cervical cancer, and I touched upon this earlier. So with cervical cancer, we're looking for those early changes, those precancerous changes. With breast cancer, we're looking for early signs of cancer, so where women might not have any lumps or any abnormalities to see or feel. So it's targeted at women between the ages of 50 and 70, but in some areas that has been extended to include younger and older women. And it's through special X-rays called mammograms.
And this is something with breast cancer. We know the story very well of Angelina Jolie and people where this is a hereditary thing.
So there is a very strong link with certain types of breast cancers with genetics, but the majority of breast cancer is not hereditary, and that's important to understand. If you do have family members who do have breast cancer, then it's really important for you to go to your GP, because you will then be referred to a special geneticist to have extra tests done. That will be separate to the screening program, but the screening program targets healthy women who have early stages but can't really see or feel anything.
Because again, just because you don't have any breast cancer in the family doesn't mean that you can carry on throughout life assuming you're not going to get it.
Exactly. So we've seen quite high profile people, like you mentioned, Angelina Jolie, and sometimes people might feel that this is a cancer that only affects families, and if we don't have anyone in the family, then we're not at risk. And like I said, the majority of cancers, breast cancer is not hereditary, so it's really important for you to still do the screening. But more importantly, I think women should be examining their breasts and looking for those early signs and making sure they see their GP if they are concerned about anything.
And it's been our message throughout this entire series, as with everything, if there's anything different with your body that doesn't seem like it normally is, the first place to go is your GP.
Yes, exactly.
Let's talk a little bit more now about the cervical cancer when it does actually get to that point that people get it, whether it's because they haven't been screened or whether that's just one of those things. How many cases are we talking about a year? How big a problem is it?
Cervical cancer is the 12th commonest cancer in the UK. Like I said, since the cancer screening program has been introduced, the prevalence of cervical cancer has decreased. So that's maybe perhaps why it's number 12, but it just shows how effective the screening program has been.
And if it does get to that stage, what sort of treatment would there be for somebody? People might be watching who are one of those unfortunate individuals who it has developed. So what goes from there? Because we hear about cancer rates, the fact that people can have treatment and have successful treatment for cancer. Does that still work for cervical cancer?
Yes, it does. So that's why it's really important for you to be really vigilant for any symptoms and signs of cervical cancer, because the screening program, it's every 3 or 5 years, but you can always develop cancer in between. And so if you're one of those unlucky people who have developed cervical cancer, then the treatment will be tailored according to how advanced the cancer is, where it's spread. And it's a combination of treatment options, so it may involve surgery, radiotherapy, chemotherapy, depending on what type of cancer you have and where it's spread to.
And with both sets of screening, are all doctors, is your GP going to know all about these things, or would you often have to then get recommended to go to a specialist?
With the screening?
Yeah.
So if you go to your GP, they would be able to counsel you about the screening programs and what the benefits and the harms are. I do it routinely with my patients as a GP, so you can always go there. There are also some resources online, so you can look at NHS UK or Cancer Research UK. They have some information leaflets as well for patients.
And we'll catch up on that a little bit later on for any further information people want. But for the moment, thank you very much. I know we've got lots more to talk about, but it's now time for a quick break. But when we return, we'll be answering your questions. So don't go anywhere. We'll be right back. Welcome back to the Health Show, where our topic today is cancer screening. The phone lines are now open, and the number to call is 020 7374 6423. Again, 020 7374 6423. And you can also email your questions to us at healthshow@islamchannel.tv. Once again, we should stress that should you suffer from any medical problems, it's always highly recommended that you contact your doctor or GP, as the Health Show gives you an alternative viewpoint to the health concern being discussed. But just before we take your calls, let's introduce our Ask the Pharmacist segment, where our qualified pharmacist, Adnan Hanouf, gives advice on how to get the information you need from your pharmacist, focusing on women's health.
Hi everybody, it's Adnan here, your local pharmacist. So today on today's show, we're discussing women's health. What can we at the pharmacy do to help women with their certain problems? The first thing that women need to know, a pharmacy is a great place for advice and treatment. But because of these issues of women's health, they can be quite sensitive. Women should be aware that there's always a consultation room available. And that consultation area is a private area away from the public space where you can talk in confidence with your pharmacist. You can be open and personal, and that's between you and your pharmacist. But that's very important to discuss these issues. The other thing to keep in mind, there's usually a female colleague available at the pharmacy. So if you feel more comfortable in talking with a female, that opportunity is there for you, and it's always available at the pharmacy. Some of the things you need to know, a pharmacist can always recommend products for general day-to-day problems that women may face. Things like cystitis, vaginal thrush, even period problems. There are products available at your pharmacy, and once you use those products, you may not need to see the GP at all. So it's a good idea to pop into your pharmacy first. The other thing to keep in mind, what can the pharmacy do in terms of services to women? We have many services available that can help with women's health. Things like pregnancy testing, things like chlamydia screening. We also have contraceptive advice. We also have sexual health advice, even pregnancy advice. So people who are trying for a baby, there are many vitamins and minerals that are available, many things that you need to be aware of that are important to help you try for a baby. Also, throughout pregnancy, to maintain good health, dietary advice and vitamins, what medication you should be taking, what medication you cannot take. All this information is available with your pharmacist. So make sure you go there for that advice. After the pregnancy, there's issues like breastfeeding. Very important topic, and many people don't think of this as important, but it's very crucial you understand breastfeeding, the best you can get out of breastfeeding for your children. We always recommend you try to breastfeed your children. Bottle feeding is available, but try your best to promote breastfeeding in your families. After this, women will go through other problems, things like menopause, and we at the pharmacy do have products available that ease the symptoms of menopause. If the symptoms get too problematic, sweating, hot flushes, things like this, there is an opportunity to see the doctor for hormone replacement therapy. That's available, and that will definitely help those symptoms. Remember, we're always here for you. If we can't help, there are other places that you can go to. There's your GP, but there's also many sexual health services that are available in the community that will give you further advice. Hope that's been helpful. Back to the studio.
Thank you very much indeed, Adnan. What a great asset to the show he is. It gives some great advice. And we were talking there while he was discussing women's health and how the pharmacist can help. But the role of the pharmacist is becoming greater and greater in Britain, isn't it? Yes,
so they are a hugely valuable resource. They are very skilled professionals. They're able to manage a lot of common problems, common ailments. And so even, we tell our patients to go and see their pharmacists for simple things that, like colds, coughs, but also cystitis, women's health issues, sexual health problems. They're very competent in managing this.
And I like the way he said it was private. There's always a female colleague you can talk to. And I'm assuming that they will automatically know the limits of their abilities in terms of what they can recommend, what they can do, and when it's important to involve a GP.
Yeah, they're very good at doing that, and they'll always signpost to GPs where it's necessary.
Fantastic. Well, we are ready now for your calls. If you'd like to call in, Please do. That's what we're here for. And I know that Hina is here ready and waiting for any call that you might have. And bear in mind, the chances are the question you have is something that's on everybody else's lips as well. So please do. And we do have our very first caller. So a very good afternoon. Perhaps you could tell us who you are, where you're calling from, and what you would like to ask our doctor today. Good afternoon.
Yeah, hi there. Hi, I'm calling from Leicester.
Yeah, what would you like to ask?
I don't want to actually ask anything. What I wanted to say was the discussion that you're having today about cancer. I've just come out of hospital with a hysterectomy, which I went into with a normal.
Okay. So, well, thank you very much for your input. It's always good to hear from people. Okay, we've lost that call as well. But do we have anybody else on the line? Yeah, we do. Okay.
I wanted to know, what is the success rate of being cured from cervical cancer?
So, what would be the success rate of treating cervical cancer?
It depends on how early it's caught. So if it's caught very early on, so it depends on kind of the different stages that the specialist, the gynecologist, will kind of categorise your cancer. And if it's early stages, stage 1, the success rate is very high, over kind of about 80%, but it declines as the cancer is more advanced. Like I said, on the whole, we know that the screening programme saves 4,500 lives from cervical cancer a year. But with individual cases, how successful the treatment is going to be depends on how advanced the cancer is. And so it's really important to catch it early.
But the good news is that the success rates are getting better and better.
Yes,
which seems
they
to
are.
be something we're just better at,
Yes,
aren't we?
yeah.
Excellent. Okay, I don't know if we have anybody else on the line at the moment. Yeah, I think we do. We're just going to put someone through to us here in the studio. Hello. Who's calling? What would you like to ask?
Hello, can you hear me?
Yeah, we can hear you. What would you like to ask?
Hi. Having watched, my question was, actually, having watched the clip earlier of, is it the 98-year-old lady? My question is really, can physical activity, can it actually reduce the risk of breast cancer? I'd just like to find out if...
Well, it's very interesting because we did talk about that straight afterwards, didn't we? About yoga and exercise and how that promotes general health. So is it something that's directly related to cancer, or is it just more that being a healthy person is going to reduce your chances of getting anything?
Sure. So with breast cancer, we know that it's more common in women who are overweight. So there is an association with obesity. So if you do physical activity and you get your weight under control, then you can reduce your risk of getting breast cancer and other cancers as well.
There you go. Brilliant. Fantastic. And please keep the questions coming in. But while we do that, there's obviously people will have concerns about being screened. They might be, as you say, they were too busy. They might be concerned about privacy. All those issues we've talked about. But what about potential side effects? Are there any at all?
With cervical cancer screening, with the smear test itself, and like I said, it's a very straightforward and simple procedure. But like with any test, it's not 100% accurate. And so there is a very small chance, for example, that the screening process will miss a cancer, or on the flip side, that it might pick up changes that actually would never have developed into cancer, and those women would then undergo unnecessary treatment and further investigations. Some of the treatment that's offered for those early changes so include kind of a bit of surgery, which has been associated with a small risk of premature delivery in pregnancy. So some women might have babies that are 1 or 2 months early. So that's kind of one of the, if you can say, complications that can happen as a result of cervical screening. With breast cancer, it's a little bit more tricky. So we know that for every 200 women screened for breast cancer, one life will be saved from breast cancer, but 3 women would have been picked up who may not, with changes that actually wouldn't have been harmful or wouldn't have progressed. So those 3 women will have unnecessary further investigations, treatment, including surgery, strong chemotherapy, radiotherapy, those sorts of things.
But again, this is the same as, I guess, any form of health screening.
Yeah.
There's always that chance. We do have another call who's phoning in this afternoon. A very good afternoon. Perhaps you could tell us who you are and where you're calling from, please.
Hi there, good afternoon. I did call and then unfortunately the call got cut off. I'm calling from Leicester and I actually wanted to ask about ovarian cancer. I went in for a hysterectomy, a normal hysterectomy, but then they realised that I had ovarian cancer and it had kind of gone to the surfaces of the organs, so my surgery became major at that point. What I wanted to ask was I had no signs or symptoms of cancer, and it was really difficult to catch it. And obviously it was a shock to me when I woke up and realised that's what the doctors were telling me. What are the signs of ovarian cancer? And the other thing is, I don't think the GPs are very sympathetic towards people who are going in with symptoms. I know some of the symptoms are bloating and things like that, which I did complain about 6 months ago when it first started. I was getting bloating and kind of more gassy kind of symptoms, which GP kept on saying it was just gas, and he was refusing to send me for any scans or anything because he assumed it was just gas. How can the GPs understand better to help women to avoid getting to a further stage or be where I am right now?
Well, thanks very much indeed for your question. I'm really sorry for your experiences, but I know that will be a question that many would like to ask. And we haven't actually talked about ovarian cancer and, how that can manifest itself. So what would you say?
So, I mean, it's terrible listening to the experiences of the lady who just called in. With ovarian cancer, unfortunately, it's one of those cancers that presents very non-specifically with symptoms exactly like the ones that the lady mentioned. So, a bit of bloating, gas, symptoms that could be caused by lots of other common conditions. And unfortunately, it's only really, in a lot of cases, picked up when it's quite advanced. So there is a lot of work that's being done into looking at ovarian cancer and picking that early, because we recognise that can be quite serious, especially with catching it late, where the chances of cure are limited. There isn't currently a screening test for ovarian cancer. There is a blood test that you can do that might be associated with it, but it can be associated with so many other conditions as well. That's why we can't use it. It's not effective as a screening tool. But there is certainly a lot of work that's being done around ovarian cancer, because it's one of those cancers that presents late. It's difficult to diagnose, and sometimes when it is diagnosed, it's difficult to treat because it's been so advanced. So the message that I'd like to give women is, if you are having persistent symptoms of bloating, of gas, of even going to the toilet more frequently, or you're in particular losing weight, off your appetite, then you do need to go and see your GP and just tell them what you're concerned about. And we will test women where there are legitimate concerns for things like ovarian cancer by doing ultrasound scans and blood tests.
And as you say, it's one of those cancers which does, it's very difficult to find out. So thank you again very much indeed for that call, and hopefully there will be a lot more advances in ovarian cancer.
Yeah.
Just to remind you that we are here in our very last episode, so if you do have any questions, this is your opportunity to give us a call, so please feel free, pick up the call. You can remain anonymous if you prefer, but we would love to answer your questions. And we have actually just had an email question come in, and it's a fairly general question for women who are in their 30s. What general advice would you have for them about better health and to maybe help avoid, cervical cancer, or for that matter, breast cancer?
It's a great question. There's a lot of push towards living healthy, being healthy, because we're seeing lots of health problems. So not just cancer, but we are seeing cancers in young people in their 30s and 40s. There is a trend in the last couple of years which is quite alarming. We're also seeing people having diabetes, heart problems, blood pressure much earlier on in their 30s and 40s. So there is a real drive to now try and get people to be more proactive in the way that they look after their health. So the things that we recommend are obviously make sure that you have a good, balanced, healthy diet, and that you're doing physical activity. So we recommend about 150 minutes in total of moderate intensity activity, so that gets your heart rate and your breathing rate up, and also twice a week doing strengthening exercises like yoga, Pilates. Try and get your muscles supple as well. And when we talk about diet, we say have your fruits and vegetables, because they are rich in antioxidants. They do reduce the risk of cancers, heart disease, stroke, all those conditions, all those chronic conditions. And then in general, managing your stress. We know that stress can be associated with lots of health conditions that can be precursors to cancers and other chronic diseases, and getting enough sleep and just kind of looking after yourself and managing yourself and your time well.
And it is interesting, isn't it? We've discovered throughout the entire series how much just looking after ourselves can help all areas of our health, from our mental health, our physical health. It helps prevent many diseases becoming quite common within us, and so on. So it really is a message to keep on pushing, isn't it?
Yes, exactly.
To stay fit, stay healthy, eat the right things.
Yeah.
Why are we not getting that message through, do you think? Because to some people we are, but there's a huge swathe of the population where we're probably not getting that.
Yes, in particular, I find that in the minority communities, that message isn't going through as much. But there could be lots of different factors. But I think on the whole, the issues that we find time and time again are, lack of time. When we all live busy lives, how do we get that exercise into our daily routine? How do we make sure that we're eating healthy when we don't have time to eat our regular meals? But there are lots of ways that we can do that, and it's just about planning your day, and really making it a priority. I think if you want to make time for something, you'll make time for it.
Isn't it funny? Yes, how we will make time for it. And I know, again, from calls we've had throughout the series, from people who maybe themselves, they're doing a good job, they're looking after themselves, but they have a loved one and they're trying to get through to them. What advice would you give them to try and get that message through to people who maybe not listening?
That's a difficult one, because you can control what you do to your body and to yourself, but getting that message or getting to somebody else can be a bit tricky, especially if they're quite set in their ways and how they live their life. But the message would be keep trying, try different ways of getting the message through, maybe get them to speak to somebody who they trust or look up to, and if that message comes from them, it's more likely to have an impact. But just be persistent and be creative is what I would say.
And we've just actually had another email question come in specifically about the Asian community and age. And are there people particularly within those groups who are more reluctant to come forward for screening, for testing, or generally going to see their GP? Because there is a reluctance amongst some people to even discuss anything with their GP.
With ethnic communities, there are certain issues. So, for example, women's health issues and mental health issues, so there's a lot of reluctance in general to talk about it, including with the GP. We are seeing lots of national campaigns, especially around mental health, screening as well, and that's actually having quite a positive impact, and I'm seeing more patients come in and be open about tests or about the way that they're feeling. But I think those are two areas that actually people are not coming forward about. So it's women's health and so women's health, sexual health, and also mental health.
Well, actually it is. I think you said it's Mental Health Week this week. So maybe we can just finish very briefly on that, because everything physical is related to mental health as well. How much of an effect will it have if you have physical problems to your mental health?
A huge effect. We know that in patients who have chronic diseases, that they have higher levels of depression and other mental health problems. The two are very closely related. And the important thing to realise is, we talk a lot about physical health, but we also all have mental health, and it's not just mental illness. So it's important for us to look after our mental health as well. So the way that we, kind of perceive things or treat other people, or how we look at ourselves, and making time for dealing with stress better, doing hobbies, those can have a positive impact on our mental well-being and can, improve physical health outcomes as well. We do see that.
And likewise, trying to convey convince those loved ones around you to do the same thing and to keep them active and healthy and doing things. Because especially when we get older, we hear a lot. We actually had a great program a few weeks ago about mental health and dementia and the aging process and various things again which seem to be related between the physical and the mental by keeping your brain active and doing the physical stuff, and they seem to be very closely related.
Yes, exactly, they are, and that's what we need to understand, is they're not two distinct entities. They're very closely related, and we need to look after both our physical health and mental health, and in particular within the Asian community, the Muslim community, to get people to really talk about how they're feeling, what problems they're experiencing, and be aware of what support mechanisms are available, because there are plenty.
And again, within communities where there is a very strong ethnic diversity, there's a lot of Muslims in the community and things, there will always be GPs who are female GPs. There's always people who will be understanding of the different ethnic thoughts and beliefs.
Yes, of course, and we, within all practices, we try and have GPs that are of different backgrounds, different skill sets. And so there's always somebody available who will be able to speak to you. You feel that you might be able to relate to better.
Well, it's been fascinating talking more about it, and hopefully we've been getting rid of a few of those myths as well. But that's all we have time for today, and in fact for the whole series I'd like to thank our guest Dr Hina Shahid for coming into the studio today and for sharing so much valuable information. Thank you very much. And I hope that you watching at home are now more aware about the topic being discussed on today's show, and if you'd like any more information about the topics that we've discussed today, or for that matter on any of the shows during the series, then please do email us at healthshow@islamchannel.tv. Well, as I say, that's it for this series. We'd like to thank all of our guests for coming in, all of those of you who phoned in, and of course for you at home for tuning in every single week and for watching. We hopefully will be back for another series later on in the year. In the meantime, thanks again for watching, and bye for now. Assalamu alaikum.